Welcome to Paul's Heart. I'm Paul, author of the book, Paul's Heart, Life as a Dad and a 35-Year Cancer Survivor, available on Amazon. Tonight I want to answer a question that was asked of me in regard to caregivers. Caregivers often don't get enough attention, but just as the patient themselves, caregivers get thrown into a situation with no training, no warning, just do. And it's important that caregivers understand the role that they're being thrust into. And it doesn't matter if you're a spouse, a family member, a close family friend, or whatever. When you're thrown into the position of caregiver, there's a lot of pressure involved, and it's felt almost immediately. So what I'd like to do is just take a few minutes and try and explain as best I can from both a patient and caregiver point of view, the role of a caregiver. I've been in both, of course, as a cancer survivor and the many other health issues that I've had to deal with. So I've been the patient and I've also been the caregiver. The last one was for my late father. So when you're put in the position of caregiver, what do you do? Okay, the easiest thing, listen. Okay, because the patient themselves are usually in a situation, and by the way, this is regardless if we're talking about cancer, if we're talking about any other serious illness like Lou Gehrig's disease, Parkinson's, Alzheimer's, whatever, car accident. You're thrown into a position where you need to help someone close to you. Okay, so what do? You listen. Okay, a patient, and I'll use myself as an example. I wasn't an easy patient to have a caregiver for. I usually kept everything internal. I was stubborn. I was proud. I didn't want help. I wanted to do everything on my own. But there would come a time when you realize you do need that help. Okay, and I did eventually accept help as it was offered, but I had to ask for it. So it requires the caregiver to listen, sit back and wait to be called upon. Be there. Okay. In the instance of my heart surgery that I had a weight restriction. I wasn't allowed to bend over, which meant, as far as dealing with my shoes, putting on certain shirts because of my breastbone being open, I couldn't stretch my shoulders out. I had to ask for help. Okay? Just be there. And by the way, for those that aren't in the caregiver role, the worst thing you can do is just disappear from someone because they're going through a difficult time, whether it be treatment, recovery, whatever. But anyway, just be there for them. If they ask you to run to the store for them for something, if they need help finding something in the house, they'll ask if you just listen. And then you respond. That's really all that there is to being a caregiver, is just being there, listening and responding to what they're looking for. I know when I had to finally adjust myself from my heart surgery, when I wanted to try to return to my normal position of sleeping. Understand, while I'm in the hospital, I'm sleeping on an incline on my back. I don't have that luxury at home in my bed. And it took a long time to figure out how to position myself with pillows. And again, I wasn't able to really use my arms the way that I normally would have because of my breastbone healing. It took an extra set of hands to help me with that. Now, could I get frustrated? And was it possible that I may have lashed out at my caregivers? I don't believe that I did. It's possible. But it's also important that the caregiver understand that this isn't a normal situation. The patient, when they do that, they're not being ungrateful. It's just really raw frustration. The final thing that I want to mention about caregiving, and this is important, the caregiver needs to take care of themselves as well. That means making sure that you're eating, making sure that you're getting enough rest, and if you need to ask for some extra help, speak with whoever you're taking care of and just say, look, I need half an hour this day or every other day or whatever. Would you mind if? And, you know, consult the patient if they know of anybody else who might be able to, you know, spare a few minutes to help you out so that you can take care of things that you need to. But if you don't take care of yourself, you're not going to really be worth much as far as caregiving if you burn out, if you exhaust yourself. So you've got to make sure that you take 5 and take care of yourself. And in the end, the biggest thing that you have to remember is that there will be an end point to all of this. You know, the patient will recover, you know, be able to take care of themselves again. You know, from a heart surgery standpoint, I think it took me about 2 weeks. You know, if you're dealing with something chronic like cancer or some other disease, it could go longer. An accident, a car accident or anything like that may take longer depending on the types of injuries. But there's always going to be an end. It's not always going to be like that. And, you know, especially if it's your spouse that you're caring for, you know, you will get through this because that's how you guys got together in the first place. You cared enough about each other in sickness and in health. You know, things happen, and you're like I said, you're not trained for this role. You get thrown into it, and after the different emotions go through, you focus on what needs to be done, and that's my words as far as caregiving goes. Till next time, this is Paul's Heart.